All righty, so we have a guest today, so I'm going to be mindful of her time. Um, I'm Cicely Fleming, for the public record, alderperson of the Ninth Ward, City of Evanston, and chair of the Alternatives to 911 Response Subcommittee, which is meeting right now virtually still. Susan is our guest speaker today. We can go around and introduce ourselves, but just to give her a little more context, hopefully she got in the email, is that we have been meeting for almost a year now.
Really?
Trying to design, we are kind of a call from the community around defunding the police and some reforms around police response. We are a subcommittee of the Human Services Committee of City Council, but we've been meeting kind of trying to design an alternative response for citizens in Evanston who need an emergency response, but not a police officer or firefighter. So we did lots of work and lots of research and lots of conversations, released an RFP a month ago, maybe, only to find that at the same time the state had an RFP, or a little bit before the state had an RFP around kind of doing the same thing, launching their state-funded mobile crisis response units. So our committee is taking a little bit of a shift. Trilogy has been awarded what I think we understand to be a lot of the work that will be helping our community members who are in crisis. They are still obviously working lots of details out with the state, so we're going to be in touch with them about that. But our committee has now thought to try to shift some of our funding and our goals around some support around crisis response that Trilogy might not be able to respond or provide in terms of peer supports, but also looking at trying to launch a physical space in Evanston where people experiencing crisis can either walk into or be brought to, that will be hopefully more holistic in response, and also not like an emergency room that we know cannot really provide that support that people need, nor provide those referrals in kind of a more long-term, I don't say wraparound, but more kind of long-term support services for our individuals in need. So that's kind of where we are as a committee. So we had spoken, Susan, about some different living room model programs that are happening around Evanston, but not in Evanston. So kind of now we're on the exploration and learning of what the living rooms are, what the living room model program is, who it serves, how it works, and then ideally, I think if our committee decides, trying to figure out if we can either outsource or contract to have one open in Evanston, or if we can kind of take one on ourselves. So before I go further, Ann Rainey's on the phone. She is going to be our speaker for the living room that she offers at Turning Point next week. But this is a public meeting, so anyone can come. I also see Sue is on the call, Sue Murphy, who leads Interfaith Action, which kind of provides, I guess what we would say is our homeless shelter. We don't really have one here in Evanston, but Sue and her team provide that support. So I know that she was interested in coming to the conversation as a public observer and guest. And then Chris Boss is also on the phone. He's not an official committee member, but he leads our 911 dispatch team. And so it's been very helpful in helping us kind of understand how that program works. And as we were looking to launch our mobile response, really figuring out how to make sure those calls that come into 911 are kind of screened appropriately and the right response is sent out. The state is supposed to handle some of that now. We're still really unsure in terms of how that will operate. So we're just going to be kind of waiting and seeing, but still wanted to move forward with making sure whatever crisis response is launched, that we have a space for people to go and actually get the services they need, aside from just any kind of on the street or in their home services. So Susan, if you want to, do you want to introduce yourself first, or want the committee to introduce themselves first, which is easier for you?
Sure, I'll go. I'm Susan Resco. I'm the CEO of the Joslin Center. I've been here for 6 years, and the Joslin Center is an outpatient community mental health center with 2 locations, one in Northfield and one in Waukegan. We provide outpatient therapy, psychiatry, case management, supported employment, as well as a living room and drop-in and a therapeutic summer camp for kids.
All All right, so we'll just go kind of around my screen here and then we'll come back, Susan, for you to give us more details about that. I'm sure we'll have
Sure.
some questions for you. Thank you. Alderman Ravel or Councilmember Ravel.
Yeah, hi. Glad to be able to learn more about a living room today. That's really great. I'm the council member for the 7th Ward in Evanston.
All right, we have James Barnett. You're on mute, James.
Hello, everyone. I'm James Barnett, Community Programs Manager with Connections for the Homeless. I manage 3 outreach specialists and 5 community case managers here at Connections for the Homeless.
Patty.
Hi, Patty Capucci, the Executive Director of Impact Behavioral Health Partners. Impact provides permanent supportive housing, clinical, nursing, and employment services for adults with serious and chronic mental illness.
Kristen.
Hey everyone, I'm Kristen Kennard. I'm the Deputy Director and Director of Social Work Services at the Moran Center. We provide integrated legal and social work services to youth and young adults through the age of 26 in Evanston.
Nicole, I'm going to skip you, but Nicole is our staff person who does all our tech. Sue, I'm sorry, I'll come back to you in case you have a public comment. I remember we need to take public comment on this meeting in case you have something you want to add. Evangeline.
Hi, I'm Evangeline Seamark. I'm an 8th Ward resident here in Evanston. I'm a survivor of multiple forms of violence and a survivor advocate as well.
Maureen.
Hi, everyone. Maureen McDonald, Executive Director at Peer Services in Evanston. We provide substance use treatment and prevention services in Evanston and the surrounding communities.
And then Indira, I won't put you on the spot, but Indira is another staff. She runs our human services department. They employ 2 victim services advocates, or 2 victim advocates who go out into the community in response to violent crime support. Chief Barnes, are you there?
Hi, everyone. I'm Aretha Barnes, Interim Police Chief. Welcome, Susan.
All right, so those are our official committee members. Do we have anyone who's here from the public who wants to make a comment, or are you all just okay listening to the conversation for now? All right, Susan, if you want to take it away and just tell us everything we need to know about Joslin. I did send everyone the your link so we can obviously read some things online, but we're very interested, particularly in the living room, but I think there's probably many things that you do that we can learn from as we try to design a support system.
Yeah, so the Joslin Center has been running a living room for about a dozen years. It was first located up in Deerfield, and then we moved it to Northfield, and it's in a building just adjacent to our clinical building. It is open 6 days a week, and it is run by peer support specialists. And these are people who are trained living in recovery and really provide a very needed and necessary component to someone's recovery journey by modeling their recovery, sitting and providing support from somebody that's walked in their shoes, or talking about coping skills, or even talking about services, other services available at the Joslin Center or in the community. It's a model that we believe in very strongly, and it's really designed to be an alternative to an emergency room for people experiencing crisis, or, you know, as I'm sure a lot of us have become more aware of, the effects of isolation. We've all experienced that in some form or another during the pandemic, and just being able to come in and talk to a friendly face, you know, get a cup of coffee, sometimes is really all that's needed to get people back on their feet again. So That's our living room program. About 60% of our services are outpatient therapy. So that is typically once a week therapy. And we've got 70 different clinicians. We've grown quite a bit during the pandemic. We have outpatient psychiatry, which is about 20% of our services, and those are services for people that could benefit from medication in addition to therapy. And we emphasize that it is in addition to therapy. So we don't see people just for medication. They must be attached to some other form of service at the Joslin Center, whether it's therapy or case management. We do supported employment, and we started this about 5 years ago with Patty and Impact. And it's the same program that Impact runs. We have a staff of 4 now that works to identify our clients that could benefit from work or a different job, or there might be troubles maintaining a job because of symptoms, and these people, these staff members will work with our clients to identify maybe a different shift or a different type of job that won't cause the stressors that may be happening. And so we really look at what we do as coordinated service, and our clinicians all work together, especially, between the 2 different areas, or the 3 different areas. Starting this later on this month, we will be launching an intensive outpatient program for adolescents, and that's a program for teens 13 to 18 who could benefit from more than once a week therapy. So once a week therapy plus a psychiatrist is not enough, and it's really designed to keep them out of higher levels of care, such as full day hospitalization or inpatient. So we're doing that because we don't really have a good resource within an hour's drive to refer people to, at least for people receiving Medicaid, which is the vast majority of our client base. We offer a sliding fee scale, and we are in network with most all private insurances.
All right, you all jump in with questions. We won't be so formal with the.
What out, you said the living room's open 6 days a week. What hours are they? Is it open?
9 to 7, Monday through Friday, and Saturday is 9 to 5, I believe.
And people kind of come in on their own, or
they do, and they're guests. They are not necessarily, they can be clients, but they're not necessarily clients. So it's a non-clinical program. They are not registered in our electronic medical record unless they choose to become a client.
So do you ever get like crowds of people coming in, or is it pretty steady, manageable numbers?
It's pretty steady and manageable, and we do track the numbers and report. This is one of the programs that is funded by the state, and we track the metrics and report back to the state. So we've been able to manage the volume. There's certain times of years, certain seasons that are more difficult, but tends to be pretty steady.
And so the whole living room operation is funded by the state, or just a portion?
Yes, it is.
Wow.
Yeah.
And are there a number of living rooms around Illinois? Do you know what? There
are. So the nearest is Turning Point in Skokie. There's Independence Center in Waukegan. NAMI runs one, I believe, in DuPage County. Thresholds has one in the city. Those ones that come to the top of my head, but yeah.
Susan, I had a question just in terms of when we were as a group kind of figuring out the model of what this might look like, and we were looking at perhaps clinicians working alongside peers. And one of the things that we knew is that we wanted especially the peers to kind of know the community. So I was wondering, have you reached out to local partners here, or have you worked with local partners here in terms of knowing kind of where the high utilizers are for mental health services?
Yes, so that's a part of the program, is for our peers to go into the community, food pantries, or libraries, or police, hospitals, and just, try to not only share that with the staff, but if the staff say, there's somebody that usually comes to pick up a bag of food on Tuesdays, and maybe if you want to swing by, I think he might or she might benefit, then we try to engage. But the peers are the ones that are doing that outreach. And then in addition, everybody that comes and leaves the living room is evaluated very briefly by a clinician, a licensed clinician, to make sure that it's an appropriate level of care, and that the person is safe, and that they're, not needing a higher level of care, and that they're safe to leave as well.
So, okay, thank you. And so would you anticipate that the peers that you would hire or bring in would know the Evanston community then?
Definitely.
Okay. All right, thanks.
I have a question about how you think about what the living room provides, from a crisis stabilization perspective. There's a lot of different measures of, what someone's state of crisis is, but if they come in at a level of agitation and they leave in a better place, that's always a good thing. So I wanted to ask kind of how you think about the process of de-escalating someone's crisis during the time that they're at the living room, and what kind of measure you use for that.
Yeah, so it is very individualized, and sometimes we have a private room, so that people can just sit either by themselves, or they can sit with another peer, or they can sit with a clinician. And then there's also a room where there's activities going on. And we publish the activities. So, it could be a cooking class, or game day, or something like that. But it really is based on the individual and their, ability to communicate how they can best de-escalate. And if that's not always possible, then that's where the peers step in and say, well, when I'm feeling stressed, sometimes if I take a deep breath or whatever, coping techniques that peer finds especially helpful, they can model that. Or they can say, hey, if you just want a few minutes to sit in quiet, we'll check in on, in a couple minutes, and here's bottled water and a granola bar. And so it's really based on the needs of the individual.
Have you looked at the impact on emergency room visits?
Well, quite frankly, we would love to. We do reach out regularly to the emergency rooms. But in the area where our living room is now, we don't have any structured relationship. What we are doing, however, in Lake County with the Lake Forest, Northwestern Lake Forest Hospital and Grays Lake hospitals, is we have a care coordinator that is assigned, a social worker that goes into the emergency rooms and helps to engage those people who tend to come back frequently or don't need inpatient hospitalization, and engage that person in therapy. Sometimes that takes a while, and it takes somebody that's very engaging and then also, you know, is able to make a lot of phone calls to that person, may arrange for transportation to make sure that that person is connected with the therapy or the case management services that might be helpful.
I'm curious in terms of your experience with incidents of community violence, for example, and if people have used the living room to be a resource in that case, like whether it's schools that have reached out because, you know, students are impacted by the violence, or young adults who are impacted, and families, neighbors, et cetera. And if that's sort of a vision for a living room model to support people in that type of crisis.
Mm-hmm. So first of all, our living room is licensed for adults 18 and above. So we don't really do a lot of, we don't do any outreach with the schools for that particular program. We have other programs for schools, but if somebody is aggressive or anybody's feeling unsafe, at that, the peers are trained to call 911 and ask the police to come. We do have, one of the nice things about the location of our living room is it's a block from the police department. Knock on wood, we've never had to do that. But because our peers are trained in de-escalation techniques, but you know, it's definitely something that if we feel that it's out of our control, we would.
So maybe I wasn't clear. I was actually talking from a perspective of a survivor. I'm a survivor of gun violence, and so I'm wondering, like, what you do or what a living room model would do to support people who are seeking help. Not an assumption that they would naturally be.
I understand. Yeah. So if somebody is looking for support, they could come into the living room and anytime that we're open and talk. If the peers think that the person is experiencing trauma or could benefit from a more structured therapeutic intervention, they, you know, would say, hey, would you like to, you know, meet one of our therapists? They could do an assessment. It would take about an hour. It might help, you know, just, and really kind of gauge if that person's receptive and ready to engage in more formal therapy.
Thank you.
No, I really appreciate you asking that question, Evangeline, and thinking about it kind of from that perspective, you know, like when what's going on isn't primarily within the person themselves, you know, these situations take on another dimension, and how we think about, you know, a living room or type of non-police response in Evanston that gives us, you know, a really robust capacity for that. I've been a part of some conversations over the summer about, you know, ways that we could support some of the communities in the My City, Our City program, you know, who are working on building community again. And a lot of what we heard in the beginning went, oh, wait, Kristen's here. Why am I talking about this? I'll just finish my sentence and then ask you to talk. That, you know, that people were afraid to leave their homes because of what had been happening. And, you know, so having to leave your home to go to a living room, probably not great. So we were trying to think about, you know, is there a way to put a living room and make it a pop-up, or put the resources of the living room in a place or a way that people would feel comfortable accessing them. And it feels to me like we're still kind of halfway to thinking that through. But Kristen, I wonder if you have any thoughts about that from the summer.
Yeah, I think the other thing, I agree with everything you said, Maureen, but I think the other thing we could think about is, another thing that we've gotten from adults, that we've gotten from children, everybody alike, is that they want more of a presence coming to them, and showing, right, that even in the neighborhoods and the blocks and the things like that, that where things may be more difficult or they're experiencing trauma after trauma after trauma, that it's not easy to leave home. It doesn't feel safe to leave home, but how do we still, as a community, as organizations within the community, as peers within the community, still show our support and show up to them? And so I think it's important to think through, if we can find a way to do that and to make ourselves present, which has happened a lot this summer, and I think we are starting to pull some of that out, then you can form those relationships that then I feel some people will feel more comfortable coming out and going to a living room setting, or that initial contact and that initial, relationship building, I think, is so important, because once you do that, we've had quite a few that hadn't left their homes, and now they feel more connected. And now it's kind of this warm handoff to an agency that can then provide, therapeutic services or peer specialist services. So I think it might be thinking kind of in a both and way, that even if, we aren't, something like a drop-in or, kind of a pop-up would be great, but I think we can also think about it in a way of how peers and organizations and whatnot can, I know in mental health, is a lot of times, you meet the client where they're at, and we think about that mentally, but I think we also need to think about that physically, and how we can do that, and actually meeting clients where they are and helping them feel safe. And once you make those connections, oftentimes then they may be okay going with somebody, or eventually on their own to a drop-in center or a living room type model.
Yeah, and I think that one of the barriers, especially for young adults that I know of, is that there are a lot of, well, I shouldn't say a lot. There are a few places that offer like the sliding scale, but it is a 3 to 6 month wait. And so you take the initiative after you get over your shock of the trauma that you experience, you take the initiative to try to get some supports, and then you hit that barrier and you decide it's not worth it, right? And so how do we, provide a space, connect all the dots, and then eliminate some of these barriers?
Yeah. Well, and one of the real benefits of both the living room and the mobile crisis response is the immediate access, right? And so still we want to make the threshold for that not too high, so that somebody would be willing to take the risk and the vulnerability to do it. But yeah, so I think as a committee, we've been talking about how to layer these things together, and integrate them. And especially as, there's some new resources coming forward from the state, but it is, it's interesting to think about the right way to position things for all, because there's so much going on, right? How do we respond to everything?
I think another thing that we learned over the summer, and I'm not sure, I know Susan, you mentioned how you have like drop-in and then the living room. Those are, connected, but with the community centers that we've had open this summer for the high school age students, but I think we could think about a model like that for young adults and whatnot, because what we've learned is high school students, could come from 6 to 9, Monday through Friday, and they come and sometimes there is conflict and sometimes there are things going on, but because we are right there in that moment and there are, staff there and you're able to then address those things immediately. And then once that staff has that relationship, and we've been able to do like restorative circles and things like that, where they've actually learned kind of how it happened and why it happened, and then what those needs are, right? Needs arise out of conflict. And as long as it's a safe place to have that, now we have people asking, okay, well, where can I go to talk to somebody? So then if there was a living room model, then it is a place to go and hang out, and then also potentially, be referred for, therapeutic services if that's appropriate. But this summer it's just been with high school age kids, but I think we could think about, how to, you have drop-in centers like that, and people are generally in vulnerable places and things like that. But it's okay for conflict to arise if they're right, if the staff is in place and if there are things in place to be able to address that. And that's, as we've said, that's when it's happening is when people are gonna, you know, really look for the help and the assistance. I just think it's another thing we can think about.
If I could just jump in and address some of these things. First of all, what we've learned, as I said, our original living room was located in Deerfield. And when I came to the organization, we immediately moved it to the location in the Joslin Center. And now it's grown so that it's its own building next door. But what we've seen is that it's really benefited the guests being connected to a mental health center as opposed to being a remote location for a lot of reasons. One, it's just, it makes it so much easier to connect people to other services. The other thing that we have learned through the pandemic is that while we've been doing Zoom sessions with the living room until just recently, the living room model is one of the models that really does seem to work better in person. Our therapy model is going great, and we've been doing, we were doing psychiatry remotely we've been doing that for almost 4 years now. But the living room is one that it really, that face-to-face interaction seems to be a little bit better. And then the other thing you had mentioned about if somebody does come to a living room and then they decide to make that step to do the hard work to engage in therapy, our average wait time is 3.5 days. So we really work hard to make sure that when somebody is ready to engage, they can do it right away. And finally, I just wanted to say that we are actively looking for locations in the Evanston, Rogers Park area because we have 160 clients that live in Evanston. And, you know, I don't know if you've made that commute between Evanston and Northfield. It takes about a half an hour. And if you're on public transportation, it takes an hour. And so our goal, because we serve 100 communities throughout Northern Illinois, our goal is to locate our services within a half an hour on public transportation to any of the communities or clients that we serve.
Susan, I just want to jump in. We have Angela, who's another committee member, who's having some tech issues, but she's here. She is a small business owner downtown Evanston, and so she kind of helps us to remember the impacts of, on our residents who need supports that we don't currently have, who are also likely homeless and or just kind of, what that impact is on our downtown business district. So sorry, Angela, for the tech issues. Susan, so your point about looking to open in Rogers Park or the Evanston area. So since you're state funded, I'm assuming you have no geographic limitations on who you can service.
Well, the living room is state funded.
State funded, that's what I meant to say.
But yeah, so community mental health centers used to have catchment areas, and ours was like maybe 14 communities. But as the funding from the state started drying up, going back almost 20 years ago, people started searching wherever they could to get services. And the catchment areas really have just blended. So now we have residents from over 100 communities that we serve, and we just think that an hour commute is too long to see your therapist.
And then you did say you take Medicaid and Medicare, was that correct?
Correct. And
Okay.
we have a sliding fee, and we have what we call a sunshine fund. So people that may be eligible for Medicaid, but are not enrolled, we have a fund so that we can start seeing them immediately. And then once Medicaid kicks in, they don't have to wait, because sometimes it can take 60 to 90 days to get enrolled.
Okay. And then my other question for that was, I know you said you only see 18 to, or over 18, but you mentioned, I think a therapeutic camp, and there was something else that I have to look back on the website. But as
Mhm.
people, maybe start just by coming into your living room, and then if they get connected, they decide they want therapists, are they then eligible for the other services as well?
Oh, yeah, absolutely. Um, Yeah.
Okay, great.
It-
You have a timeline on when you might open in the on the north side?
Well, we're looking at locations. We've identified one. We're really hoping to secure some of the ARPA funding coming through the various municipalities and counties, and
Yeah.
just
Okay.
trying to find that it's almost like playing Jenga.
Well, the state of Evanston, we just had our first conversation about it yesterday, in very broad strokes. And I will say that several people on the council did talk about our desire to see the money going, some of the money going to mental health services,
Mhm.
not obviously identify what those are, but knowing that that is a huge need and gap for services. So that is definitely a priority for the city of Evanston. And I can make sure that I loop you in with staff, because we're going to start the process of figuring out how to allocate those dollars. But
Okay, great.
mental health is definitely high on the list. I think about 4 or 5 council members reiterated that yesterday at our meeting. So
Yeah, well, as some of the nonprofit leaders on the call know, that as a nonprofit, we don't pay property taxes, and so it cuts our occupancy expenses by about a third. And it's really the only way that we can sustain our programs on the razor thin Medicaid reimbursement rates. So we see the ARPA funding as a nice synergy, because it would provide one-time funding to purchase a building, and then we raise the rest to do the program startup.
Susan, can I ask you a question? I'm just trying to wrap my head a little bit around the model when you're saying that folks that are coming to you have to travel, like they can't see, are you saying they can't see a therapist within an hour's time or 30 minutes? But I mean, we do have a lot of agencies in Evanston, and there's a living room in Skokie. So I'm just not sure what geographic area you're referencing when you're
So
talking.
we're looking at all of the clients that come to the Joslin Center, that they come from 100 different communities in Northeast Illinois.
Okay.
When you look at the geographic map, there's Medicaid, when we're talking Medicaid facilities, there's Lake County Behavioral Health in Waukegan and Libertyville. Turning Point is in Skokie. Amita Health is in Arlington Heights. Leiden is in Franklin Park. So if you're looking for outpatient psychiatric services, that's.
So you're going that, I just wasn't sure if you were talking about the Evanston area and community.
Well, so a lot of people, like I said, we have 160 clients that reside in Evanston and 120 that live in the city. For either they weren't able to wait the 3 to 6 months that Evangeline referenced, or they found us through other means, but
Okay.
yeah.
Okay. I was just trying to figure out the hour. I'm just trying to figure out the map and services around, because that's something we're also trying to look at, is on a different committee. I am all the gaps and things with mental health services. So, okay.
Well,
All right.
the facilities, as you know, that accept Medicaid, that provide therapy and especially psychiatry, are pretty few and far between.
All right. Gotcha. Thanks.
Then can I clarify? So if and when the Joslin Center were to potentially have a location in Evanston or the north side of Chicago, for a living room, would then they also, if they chose to engage in therapeutic services, be able to get therapeutic services out of that location?
Yes.
They would. Okay. I just wanted to clarify that.
Well, and Susan, you mentioned purchasing a building? Is that what you're hoping to do in the Evanston, Chicago area? So not.
Yeah.
not just,
Yeah, that is what makes it sustainable because of the, property taxes are about a third of the cost of our occupancy, so.
Yeah.
And those, sorry, just to finish that sentence, those property taxes are passed through a lease. So that's where the savings come in.
Any more questions?
I have a question for Susan. Do you get many homeless individuals who either walk in or dropped off at your at Turning Point? And if so, who do you refer them to?
We're the Joslin Center, and we, yes, we do. So we have a number of referral partners that we talk with. The first is to see if we can get permission to speak with family members so that we know where the support systems are for this individual. It may be that family is not a source of support, but that's one of the places we look. And then we refer to the housing entities that are in existence. And as you know, that's what you do. And we have a partnership with Connections, but depending on where the person is located, we will refer to that agency.
Anyone else? All right, Susan, thank you so much for that information. I think that gives us some hope.
Well, thank you for inviting me. It's really nice to talk with you all. And I really want to thank you for addressing this issue. It's so important. And I think it can really strengthen communities when there's adequate mental health support. So thank you for considering it.
Yes, thank you so much. And I'm Councilmember Ravel and I might be back in touch with more questions, or as we move further and figure out what exactly we're doing. We might have more questions for you. And for sure, please keep us posted on,
right.
If you decide to move and what that looks like. And then, as I said,
definitely will.
Maybe Nicola or Indira, can you please follow up with Susan to give her the link to our new ARPA website on the city's website? We can try to make sure we keep you up to date with our funding here in the city of Evanston.
Mm-hmm. Yeah.
Thank you again.
Thank you. All right, guys, so next, or not guys, team. So next week, based on the schedule we set before, not next week, sorry, in 2 weeks, our next meeting, we'll have the folks from Turning Point on to talk about their living room model that's obviously up and running at Skokie. Then after that, we had spoken about having some staff from the school come to just kind of tell us about what they're doing for crisis support for students. Kristen's working on getting that. That would be August 24th, but we know they'll be going right back to school around that time, so we might have to push that back to September based on their schedule. I know Alderman Ravel and I, we need to double back with Trilogy in terms of where they are with the state contract that they received, and ideally getting more information from their next kind of step there, and making sure we're in the loop of when they're going to be launching their program. The other update is that we did have Deputy Manager Gandersky reach out to Amita about potentially partnering with them or using some of their space. Sounds like they have some leadership flux right now. So we are awaiting, I think, a meeting with, I can't remember, someone over there. So we're awaiting the date, and we will meet with them just to kind of see where they are and if they have space and what a partnership might look like. And then, as I mentioned to Susan, we did have our first conversation about the city's ARPA funds and what that looks like. So it was very kind of broad brush. Where we landed, not necessarily on a dollar amount, but the thought process thus far is that for our social service providers, there will be essentially like an application. And so folks can come and apply for a pool of money. We have a new social services subcommittee that will then, kind of look at those applications and, go from there in terms of doling out money. But that's all going to get going up on our website in the next few days. I think there's going to be much more community engagement. We haven't quite landed on what that is. We want to make sure we try to touch as many people. So a little bit non-traditional engagement. And then for our social service providers, we also were told that there are some non-municipal attached rescue funds that I think are supposed to be available for you all. So we did talk as a city about how we can either utilize our city staff time or what have you to help you all kind of access those funds as well. And then the last part probably for social services is that we will have some money that kind of is, what do we call it? Infrastructure, something another. That sounded like, I mean, again, none of this is set in stone, but did sound like it was something that might be accessible for social service agencies as well. So that is all going to be rolling out, probably something new each week. So I'm sure you all are all looped in, but we'll definitely do our best to remind you and tell you how those things are going. I think we were able to apply for the grant. We talked about a federal grant. There was some technical issues on the grant website. I spoke to Ike yesterday. He had a call in. It sounds like they were going to let him submit our application just as a PDF email.
No.
We'll keep you posted. We'll keep you posted on that. There was a grant for $500,000 through the Department of Criminal Justice or something that was trying to do this kind of alternative non-police response funding. So we definitely will keep you posted there. And then obviously, as soon as we hear from Trilogy and Turning Point, who did secure state grants, we will launch into action as soon as we can to make sure that if we just start even with the response, that we are still making sure we understand that and helping with that community engagement piece once we know what that is. There's still the 988, Eleanor, was that the number?
That sounds about right.
So they still didn't know how that was going to work. I mean, there was still just a bunch of unknowns on the state side. So we will be getting that information to you all as soon as we get clarity on that.
Yeah, no, it's really exciting how many different levels and entities are all, really recognizing that crisis response is a really important area for new attention and new funding. And so it's, I'm very hopeful that it's going to, yield something really positive for Evanston.
Yeah, I know for me, when I attended sort of first conversations about this, even before you all formed the committee, so it's sort of been like last summer, almost a year ago, it seemed very like, okay, clearly we have to do this, but like, what do we even think about? And, only this one little program in Oregon, like knows anything about this, right? Like, and now here we are a year later and things have moved very fast, which is as it should be, right? We need a whole nother level, next level set of solutions here that we don't have.
Right, yeah.
Could I ask just two clarifying questions, one about ARPA and one about city stuff?
Sure.
So for the ARPA funds, there are a couple of groups. Evanston Mental Health Task Force is one, and we have kind of global recommendations that we would like to share with the city that are not, funding recommendations or applications of any kind, but kind of like, okay, this is where our thinking is right now. Does it say on the ARPA website where to send those thoughts?
Probably not, because I think nothing was really up there yet because we hadn't had a discussion. But I would say, so your task force of the mayor's task force. So I would definitely say to send them to the mayor.
Right. Okay.
You can also send them to Council Member Ravel and I. I can't remember who was on the social service task force, and it's
we got the names of the people. So yes, that'll be just kind of getting underway just probably next month, but that would be obviously the important group to get that information. Yeah,
great.
Yeah, but I'm happy to receive them for now if you
Sure.
guys have them ready to go. There was kind of a conversation about that, about economic development as well, just kind of general recommendations that were not tied to one specific business.
Yeah, like these are things that need to be done, and we're all happy to help make them happen. But it's like beyond any one of us to figure it out.
Sure.
Yeah. That would be great. And then the other side is a number of us who are on this group, and then of course others are in the Evanston Mental Health Board process. And I just wondered if there's any update on the timeline for that. And if we can't discuss that in this forum, that's fine. Just point me in the right direction.
Boy, is that being merged into?
No, I think that's still its own
It's
thing.
still.
You mean the timeline for applications or hearing back? I don't even know where they are with that.
Yeah, I mean, we all submitted applications
okay.
a couple months ago and we're hoping that we would hear by July, and we have not. So
Yeah, I mean, that's a Sarah Flax question, but you haven't, Sarah or Jessica are still the point for that.
Mhm.
yep, I'll follow up with them. I know a lot of us were hoping, we built stuff into our budgets with hope, so we're just we'll just keep hoping.
Yeah, I am not sure.
Yeah.
I'll follow up with Jessica and Sarah.
Okay. All right, I think the only last announcement, so we're back to every 2 weeks. I know we have been working, you guys have worked so hard and been so committed. So maybe is the unsaid rule, but if anyone needs to drop off of the committee for whatever reason, please, feel free to take care of yourself and do that. Obviously, we will keep you updated. We will give you all the credit for all the hard work that you've done, but we don't want you to feel held hostage now that our committee has gone super long and now taken another turn that might take us a little further. But I do very much appreciate the time and the talents and all the input you guys have brought to us. Has been super valuable, and probably at some point soon we should go back to council and give an update, but we're a little bit in flux now, so maybe we'll wait to have something to give them. So if we don't, Kristen, if you can't get a school person, just, let me know, and then maybe we can see if Trilogy is ready to come back with their update on the state grant, or we can kind of figure out where we are for that August 24th meeting. Was there one more group we were trying to speak to? I feel like I'm forgetting one group. Was it just, maybe not? Okay. All right, I tried to. Okay, all right. And so I think that is all I have. Do you have anything else, Eleanor?
Nope, we covered a lot. It was good.
We did cover a lot. And then, the Joslin website I looked at yesterday, so it is pretty, if you have more questions, it's pretty thorough. All righty. Well, thank you all again for another hour of your week, and we will see you in 2 weeks.
Right. Okay. Bye, everybody.
Everyone.
Bye, everybody.